join me in welcoming Ms. Clark. She works right here at East Senior, and
Hi, everybody. I see some familiar faces, some new faces. I'm Ms. Clark. You may or may not know me. I work in the building. I'm a speech-language pathologist, and I'm working on my 15th year in this school district. And when I tell people what I do, the first thing I get is, "You're a what?" And then I'll say, "A speech-language pathologist." And they'll say, "Oh," and I can see kind of a confused look on their face, and then I go into a little bit about what we do, because this presentation is a lot about what we do. And invariably, I always get, "Oh, I know so-and-so in my life, family member, friend, they couldn't say their R's when they were younger." That's a little tiny bit of what we do. So I'll say, "Yep, that's part of what we do," and then usually we move on to the conversation because I don't have an hour to explain what I do. So I'm so excited to have your attention to tell you what it is I do. And Mrs. Pava's going to move along for me. Okay, so formally, I'm a speech-language pathologist, and in therapy, we work on speech and language, but does anybody know what pathologist means? Anybody ever heard that? Okay, it's a fancy word that basically means we're in charge of finding out what's wrong. If you have something removed and you send it to pathology, they're looking at it to see what the problem is. So our job is to find out what the problem is. At the end of my name, this is my name right here. Whoops.
sorry.
Oh, sorry.
Touchscreen.
Okay. I have a master's degree, so we get a whole bunch of letters at the end of our names. So I have a master's degree, certificate of clinical competence, and then I'm a speech-language pathologist registered with New York State. So if you complete the programming and you get your degree, you get all these fun letters at the end of your name. And as we said, SLP stands for speech-language pathologist. Yes, please. Okay, so I'm going to give you a small taste of what we do, aside from just fixing R or S. In the clinical setting, in a hospital, in a rehab situation, a speech-language pathologist could be, or would be, responsible for figuring out pathology with swallowing. So I'm going to show you just kind of a cool little slide about what it looks like when we're going to do a swallow study. So raise your hand if you've ever swallowed something and it's gone down the wrong pipe and you've choked. Okay. All right. So this is what we see when we have somebody who is back from a stroke or has some kind of physical injury. Our job is to figure out why their food or drink are going down the wrong pipe. We would do a modified barium swallow study, and we would look on an x-ray to see where the swallow breakdown is happening. Excuse me. So in this, you're going to see a normal swallow, and we're going to give the patient a little cracker with a little bit of barium on it so it shows up on the skin. And what you're going to watch for is the chewing. You're going to see the skeleton kind of back up, the chewing mechanism go, and then you're going to see the swallow happen, and you're going to see a black substance, which is the cracker, the saliva, and the barium, going down the throat. You're going to see this little flap right here, which is the epiglottis. It's going to close, and it's going to send the food down the esophagus into the stomach. Okay? So I'll have Mrs. Pava play that. Okay, did you see the food go down? Okay. Now, this is a typical, we're going to just go back to that. Can we just replay right there? Thank you. So, if this were a problem, we would see this epiglottis not close and the food come down through the airway, down your throat. And that's where the choking and the sputtering and that feeling of it going down the wrong pipe would happen. Now, as a speech pathologist, it would be our job to figure out where that breakdown is happening, why that breakdown is happening, and modify their diet so that they're safe. Does anybody know what would happen if all that food and liquid goes into your lungs? What could happen?
Would die.
Possibly.
Aspirin.
Yes, aspirate, aspiration pneumonia. And Charles, well done, sir. Excellent. You may choose a prize. So we want to stop aspiration pneumonia from happening. So it would be our job as a speech pathologist to then go in, teach compensatory techniques, swallowing exercises to kind of strengthen those weaknesses of those structures, teach them different ways to move their heads so that they can swallow correctly. So that's just a small taste of what we do outside of the school setting. Obviously, we don't work on that here. Okay, so I'm a speech language pathologist. What's the difference between speech and language? Anybody want to take a stab at it?
Pronunciation is different than words.
Okay, pronunciation is different than words, absolutely. Anybody else? Okay, that was perfect. Well done. You get a prize. I reward participation, so feel free to choose something. Okay, next slide. Okay, in language therapy, in the school setting, in the medical setting, students or individuals who have difficulty with language would receive language therapy. So there's two sets of ways we look at language. It's expressive and receptive. So we'll go to the next slide. Okay, receptive language is the way that we understand, and expressive is the way that we use it. So if there's a deficit in either one of these, you would come to see me for language therapy. Next slide. Okay, speech therapy would be anybody who's having difficulty with stuttering, articulation, or voice. That's speech therapy. There may be cases where somebody has problems with both and would come for speech and language therapy or one or the other. Okay. Stuttering. I'm sure everybody's kind of heard of stuttering. We don't know why it happens. There may be a genetic component, a neurological component. Our job as speech pathologists, when somebody comes to us for stuttering therapy, is not to cure it. We cannot cure stuttering, but we can help them stutter easier. So we have a whole bunch of techniques that we can teach to make somebody more fluent with how they're speaking, and that's a whole other situation in and of itself. Very helpful, very beneficial. Everybody has something very, very, very important to say, and our job is to make them say it as well as they can. Articulation, you alluded to, is, again, a small subset of what we do, but pronouncing the speech sounds correctly. So if you are somebody or know somebody who has a problem with R, S, TH, any of those sounds, you come to see us. Voice, people who have had surgery and have had their vocal folds nicked. They're hoarse, they're raspy, they have nodules or polyps. They come to see us, and we help them use their voice in a different way so that we can help them achieve their goals. Individuals who are transgender and need to change their register can also come to a voice clinic to learn how to speak in a different register. Okay, has anybody ever seen the inside of your throat? You have? Have you been? Throat? Okay. So I've actually seen the inside of my own throat going through school. We have had practice with the endoscopy, which you're going to see. There's a little numbing solution that goes on this little tiny cord, goes in through your nose and down the back of your throat. So, yeah, yep. You've had it done, okay. So there's a little camera on the end, and we can actually go into your throat and actually see what your vocal folds or your vocal cords are doing to see where that pathology may lie. So what I'm going to show you, there's a little bit of talking in the beginning about the man that's making, he's kind of narrating, but he'll kind of explain what you're seeing. It's a little bit, can be a little bit jarring if you've never seen the inside of your throat before, but it's kind of cool. So I'd like to show it to you.
So I don't know how the volume will be. So
Oh, okay. We're just checking the volume.
Transnasal endoscopy and anatomical tutorial, produced by Fokker Ear, Nose, and Throat Consultants of Warrenton, Virginia. Endoscopy is ready to commence. Here we have a view of the anterior nasal cavity. The inferior turbinate is what humidifies the air we breathe. The endoscope is being passed through the nasal cavity to the posterior aspect. Please note the soft palate.
So right now it's just to the back of the throat, not all the way down.
The palate moves up and down with certain speech tasks. Say baby bottle.
Baby bottle.
The endoscope will now be passed inferiorly where we will get our first glimpse of the voice box.
Okay, so now it's going all the way down the back of the throat. Can you just pause 1 second? I'm sorry.
Transnasal and
I just wanted to point out this, how this really looks as opposed to,
I am. So
that's okay, that's okay. I really appreciate you doing this.
On the pause, it keeps coming up with those other little.
transnasal.
When we were looking at that cracker, the modified barium swallow study with that little piece, that flap right here, this is what it actually looks like. Yeah, perfect, thank you. This is what it actually looks like. So this is that little door that closes off your throat and pushes everything down through your esophagus. So when this doesn't close, this is how something goes down the wrong pipe. So now what we're looking at is the actual airway of your throat. So right here is what needs to be closed off when you're swallowing. Now we're looking at how your voice is produced. So right here is the opening of the throat, and the rest of the video will explain what you're looking at.
Note the posterior pharyngeal wall squeezes together as the pitch elevates.
So right here are your vocal cords.
Here we
That's
have
your
a good view
actual
of the
voice box, what makes your voice
The
go.
rib are what moves the vocal cords together as well as apart.
This is the throat.
The strobe light will now be turned on. The strobe light allows us to visualize the vocal cord vibration. Note that as the pitch elevates, the true vocal cords become longer and thinner. When the vocal cords are apart, we are able to breathe in and out.
You can see the rings of your
A
actual
voice is
throat, of your
created when
trachea.
the vocal cords come together and start to vibrate very quickly. The endoscope is now being removed carefully.
And then they pull it right out of your nose, and you're in and out. So that's what a normal vocal cord looks like, normal vocal, your voice box. If there was some sort of pathology, which we now know something is wrong, you might have something that looks like a cyst or like a pimple there, which could obviously affect the quality of your voice. So if you're super raspy, if you're at a sporting event and the next day or a concert and your voice sounds a little raspy, it could be that your vocal cords are a little bit inflamed, so it's good for vocal rest, lots of water, not a lot of talking, limit your caffeine to try to let those heal because those are muscles also. Okay, I have more treats for participants. So if you want to try, you can. Just raise your hand. Just a little quiz so far. Next slide. Okay, we're going to do just a couple scenarios. So I know I keep saying we do more than R remediation, but if you have a third grader who substitutes W for R and they say words like, this is my bunny wabbit, or I'm ready to go, are we treating speech or language when they're coming to us? Speech, perfect. If you want to come up so I don't trip over any backpacks, you can choose something from the bucket. Help yourself. You're right. So that definitely would be, next slide. That would definitely be speech therapy because they're having a hard time producing the R. Now, would anybody feel comfortable, just thinking, you don't have to raise your hand, Do you think you might be able to teach somebody explaining where your tongue and your teeth and your lips and everything should have to be? Do you think you'd be able to explain to somebody how to produce the R sound? I've probably never thought about it. I wouldn't know how to do it either. I had to go to school to learn how to do it. So what I'm going to show you right now is this young lady. She runs Peachy Speechy. I found her on YouTube. I've seen her before, but she will actually show you what it takes to teach somebody to produce the R sound.
Hi, I'm Meredith from Peachy Speechy. I'm a speech-language pathologist, and today I'm going to show you how to say the R sound. R is one of the trickiest sounds to say, so if you're having trouble saying it, you are not alone. There are two ways to say the R sound. One is the bunched position, and the other is the retroflexed position. This video is going to talk about the bunched position, where we're bunching our tongues back in our mouths. To make the R sound, you have to slide your tongue back and up, so the back sides of your tongue touch the insides of your back teeth, and you turn your voice on, and it sounds like er. When you're saying R, your mouth might move a little differently depending on the sounds around the R. Today in this video, we're just going to focus on the sound er. So remember, the sides of your tongue are going to touch inside your back teeth in these places here. You're going to pull your tongue back and keep it tight and high. It's going to be kind of shaped like this, like it's bunched. So pull it back and up and tight as you turn your voice on. Er. If your tongue isn't high enough or isn't tight enough, it's not going to sound quite right. It's going to sound like instead of So you have to make sure it's nice and high. If you drop it, it'll be but you want to keep it high and tight. I'm going to open my mouth a little wider than I usually would so you can see my tongue. Watch as my tongue goes back and up and gets tight so I can make the sound. Now you try.
Okay, you can pause it. Thank you.
How did you do?
So one quick thing I want to point out about her shirt right here. She's got speech-language pathology, and on there she's got phonology, cognition, pragmatics, dysphagia, which is the fancy word for swallowing therapy. Kind of just sums up everything that we do on her shirt. But if you see it, it's got a whole bunch of words on it. So that is how we are to teach little ones how to do their R sound. Now you can imagine for a 30-minute session, that's a lot, especially if it could be frustrating if they don't understand how to move their tongues back. So what we might do is put a game in front, Candyland, Battleship, a craft, and before they can take a turn or a piece of their craft, they might have to practice 5 or 10 times. So I've heard it so many times working with the littles, people walk by and say, wow, I should have been a speech pathologist. All you do is play games all day, because that's what they're seeing. But what they don't know is that that kid had to work to take their turn. So we try to make it fun and engaging, especially with the little ones, because 30 minutes of move your tongue back, move your tongue back, pull your tongue up can get a little bit frustrating and a little bit redundant. So that's that. So now that's just R, but somebody might come for us for S, TH, K and G, P, B, and M. There's a whole system on how we attack these sounds, but we have to teach them separately like this before we can move on to words, phrases, and sentences. 8 minutes, okay. As speech-language pathologists, we have our own language. We have, it's called the International Phonetic Alphabet. My best friend and I are speech pathologists. She's in Central New York in Syracuse. I'm here. So she will say, I have to go outside, but I have to turn my lights on because it's foggy. We say foggy. So we have a difference in vowel sounds. If I'm going to write that down, I'm going to use the vowel over here to write down exactly how she's saying it. She says frog. We say frog. So I'm going to use these special vowels over here to write down exactly how we're saying it so that when I look at it, I can say, she's using this vowel, I'm using this vowel. The word looks exactly the same, but it's going to give us a better picture of how everything sounds. So to bring this all together. I have this on today. Can anybody guess what this might say? It's something phonetic. I love you. Perfect. So this is I, L-U-V, love, J-U. So it looks like a totally different language, which it is. And this is the breakdown of what all of these sounds look like. So we're running a little bit low on time. I was going to give you these at the end, if anybody wants to look a little bit closer at what these consonants and vowels look like. So if we have the just sound, I'll just point this out quickly. If we have the just sound, we don't write it phonetically with a letter J like we would know it. We would do this D and this Z sound to represent this just sound. So all the consonants are broken down, all the vowels are broken down. So I have this on the way out. If you want to try it, you look at the key and try to figure out what we're trying to spell. And then you can turn it into my room, which is 105A downstairs. And if you try, you can be entered to win a prize pack. I have it all put together for you. So we use this to document speech errors and to find the patterns to figure out what sound would be best to target in therapy. All right, another quick example. Your second grade student uses short and choppy sentences or incomplete sentences such as give, car, him. Speech or language? Ooh, oh boy. Okay, anybody said language can come up and grab a prize. Next one.
If we want to leave time for questions, we want to.
Okay, sure. You can flip through. I'm almost there. Okay, your kindergarten student says snake, and I can do it. That would be stuttering. Speech or language? Speech, perfect. Okay, next one. We can skip this one. Okay, real quick, I just want to tell you what school looks like when you leave high school. So it's 4 years of undergrad and then 2 years of graduate school to get your master's degree with 2 summer semesters in there. So it's almost 2 full years of school. Then you leave school after you do your 2 externships, a pediatric placement and an adult placement. It's kind of like student teaching, but you go out into the different settings. When you get your degree, you go out for your clinical fellowship year. You're getting paid. You're applying for a job just like anybody else. But you're under the supervision of somebody who already has their C's and already has their New York State license. They sign off on all your Medicaid notes. After you complete that full year, then you become fully licensed SLP with New York State. And then you can start using all of these letters at the end of your name. Next slide. All right, some courses, I won't go through all of them. Phonetics, phonology, you need anatomy and physiology to learn about the structures of the speech mechanism in the body. Special education classes, genetics, audiology. It's a lot, but with a self-care routine and some boba, you might be able to get through. You will be able to get through. Okay, next one. All right, speech pathologists can typically work in colleges and universities to do research. You can work in a skilled nursing home, acute care, inpatient, outpatient. You can work at an agency. Outside of school, I work for 2 agencies. I work with the little ones, and I work with adults with developmental disabilities. The money is very, very good if you're ready to hustle. You can work in a private practice. You can do your own voice clinic. You can start your journey in the school if you'd like. The combinations are endless. All right, so I just want to mention this quickly. My career in speech language pathology has taken me in so many different directions I can't even begin to explain. Kind of cool, I've worked with children of Buffalo Bills players, children of the Buffalo Sabres, so I've got to meet some people along the way. It makes me very happy. I can't believe I do what I do. You can set up with these recruiting companies that will send you all over the world, certainly all over the country, for 13-week stints. They'll pay you to relocate. They'll give you a stipend. Excuse me. And you go and you can go see Alaska. You can go see Hawaii. I get emails all the time. You can also become an influencer. Peachy Speechy probably doesn't see kids anymore. She just teaches everybody how to do it, and you pay her. So, lots of avenues. If you get bored working in the schools, you can go parlay that into the hospitals, go into skilled nursing, take an agency job. The combinations really are endless. Okay, next slide. Thank you so much for your attention. I know I kind of rushed there at the end. I could talk about this forever. Does anybody have any questions? Yes.
When you swallow before you start talking, is that because you're trying to block or not to get the saliva down in the
Me personally, or just in general?
general?
Oh, yeah. Yep. So your question was when you swallow, you're trying to get the saliva down.
Like when you do it before you start talking,
Yeah, absolutely. It's hard to talk with a lot of saliva in your mouth. So your question is when you swallow to get the saliva down before you start talking, why do you do that? Yeah. It's hard to manage the saliva in your mouth. It's like talking with something in your mouth. So we push it down and help lubricate everything on the way down so that we can speak our message. Great question. If anybody has any further questions, I'm downstairs in Mr. Winnicke's old office, 105A, always bopping around the building. I love what I do. I can't believe I get paid for what I do, which is why I have the 2 jobs outside of this, because I just love what I do so much. And I don't feel like I work a day in my life. Since you are all so wonderful, and I'm sure somebody has shouted out an answer that didn't get rewarded for it, everybody come take a treat. Thank you.
Let's thank Ms. Clark. She'll be here for a few minutes, so if you were feeling a little shy, you can certainly come up and approach her.
Yes,
And
please
she's in the
do.
building. You can think of a question later.